Welcome to the Personal Care Diet. In this video, we are going to talk about what is hypertension, cardiovascular disease, heart disease, etc. Many diseases are absolutely related to high blood pressure. Hypertension is very terrible because some symptoms are easily ignored. Hypertension patients in normal times do not feel pain. But when there is a sequela of hypertension due to sudden myocardial infarction, stroke, it is too late to treat it. This video will take you to understand what is hypertension and how to prevent hypertension. 1. Hypertension is not a disease but may cause other diseases. Hypertension is a common symptom. Simply put, the arterial blood pressure of the human body is higher than the normal index is called hypertension. Hypertension will further affect organs including the heart, blood vessels. Changes in brain and kidney functions may lead to stroke, arteriosclerosis, heart disease, heart failure, and kidney failure. 2. What is the standard of hypertension? According to World Health Organization standards, normal blood pressure should be systolic blood pressure less than 18.7 kilopascals, diastolic blood pressure less than 12.0 kilopascals. Systolic blood pressure depends on the magnitude of myocardial contractility and elasticity of the aorta. And diastolic blood pressure depends on peripheral vascular resistance and the elasticity of the arterial wall. 3. Classification of high blood pressure. By understanding the classification of high blood pressure, we can better understand what hypertension is. According to the cause, it can be divided into primary hypertension and secondary hypertension. Primary hypertension means that blood pressure rises. Diseases with high as the main cause account for about 80 to 90% of hypertensive patients. Patients with primary hypertension often have headaches, palpitations, limb numbness, and other symptoms. Secondary hypertension refers to some diseases that can be complicated by hypertension, which is only one of the symptoms of certain diseases. So quarterly hypertension is also called symptomatic hypertension, accounting for about 10% of patients with hypertension, approximately 20%. There are many diseases that cause secondary hypertension, including kidney disease, endocrine disease, cardiovascular disease, and other diseases. 4. People who are prone to high blood pressure. Age of ethnic groups susceptible to high blood pressure. The rise in blood pressure is relatively stable between the ages of 20 and 40. And the rate of rising in blood pressure will accelerate after the age of 40. It is easier for people over 40. There is a problem with high blood pressure. Family history. Immediate blood relatives have high blood pressure, and children are also more likely to have high blood pressure. Obesity. Obesity is one of the main factors that cause high blood pressure. Obesity puts more stress on the heart. Diet. Foods that are too high in salt and fat, low in calcium, magnesium, and phosphorus can cause high blood pressure. Avoid processed foods and eat more fresh vegetables and fruits. Stress. People are prone to high blood pressure in a stressful or high-pressure environment. Smoking. People who smoke because they absorb a lot of nicotine. Nicotine will make people's blood vessels narrow, so it is easier to suffer from high blood pressure. Other diseases. Many diseases may have symptoms of high blood pressure, partly because of hormones dissonance. Diabetes is highly likely to cause stroke, heart, and kidney disease due to hypertension. We hope you like our video. Share with friends and family to help them understand the right information about hypertension. Don't forget to subscribe to our channel and give thumbs